12:15 and we're going to get started. Thank you for coming to the Rolling Massage webinar. My name is Kathy Hargrove and I'm your BFit coordinator. Just to give a little background for me, I actually have my Bachelor of Science degree in Health and Fitness Performance. I'm a certified exercise physiologist and personal trainer. And I've been teaching the rolling massage using the tennis ball and other apparatus. And it's also called myofascial release. I've been teaching that for the last 10 years. I learned this technique through different fitness workshops and home study course. So that just kind of gives you a little bit of background of how I've come across this technique. The benefits, it helps to reduce muscle soreness. It helps to reduce muscle tightness. And I think the best one is it just promotes a feeling of relaxation. That being said, this is not replacing a massage therapist. So I'm not saying don't go to your massage therapist by any means. They are wonderful. A few things that you may want to consult with your doctor before stepping into any kind of massage. There's a couple conditions. So if you have a current injury, I would go ahead and consult with your doctor. Osteoporosis, depending on the severity of that, you may want to check with your doctor. If you're a diabetic and suffering with neuropathy, then I would also speak to your doctor before you do that, as well as pregnancy. So if you're currently pregnant, you may want to not do any massage until you talk to your doctor. So when you're rolling, I want you to roll areas that are comfortable for you. If you come to my virtual workouts, I tell you guys, if there's an exercise I do that you do not like, don't do it. So same theory applies here. If you have any varicose veins, do not roll over those as well. Do not hold your breath while you're massaging. And that's because holding your breath will raise your blood pressure. And also, do not roll anyone else. So just roll yourself, okay? And when you're doing these exercises, you know your body best. Just use common sense. If it doesn't feel good, stop it. There may be some tender spots that you run across as you do this. And it's really up to you. Do you want to roll over it? Do you want to hold that? Do you want to kind of move it to side? Use your own common sense and how your body feels as far as if you reach any of these tender spots. Okay, so let's get started. And like I said, our first exercise will be with the shoes off, okay? Go ahead and don't grab your tennis ball yet. I'm going to adjust my camera. I'm going to have you do an exercise first. So this is going to show you what massage, and I know my head's not in this, but I want to make sure you guys see my feet. I just want you to see how massage can help with your flexibility. So you're going to place your hands on your thighs and you're going to roll your back down. Okay. Now, if you feel comfortable, I want you to release your hands and you're hanging out. You're not reaching for your toes. You're just hanging out, resting your head and your head and neck. And then just look, how close to the floor are your hands? And then place your hands back on your thighs, roll it back up, roll those shoulders back. Now, get your one tennis ball, okay? And then if you need to grab onto a wall or a chair, we're going to put that tennis ball underneath your foot. So how much pressure you put on that tennis ball is really up to you. So I want that tennis ball, the ball of your foot, and then I want you to slowly roll it, nice and slow, all the way back to your heel, and then slowly roll it back up to the ball of your foot. Now, keep doing this at your own pace. I'm going to show you tender spots. So my arch is a tender spot. So I may just hold the ball right there, or I may kind of move it side to side, nice and slow. Okay, so that's what you can do if you feel any spots that are tight or they're tender. Okay, and then relax. Let's switch. I'm just going to turn for you. Do the same thing on your opposite foot. Roll it. Now, this is something that I would do before I would teach step aerobics. My calves are always tight. So then I would feel it like in the heel of my, like the muscles in my heel. So I would roll my feet before step aerobics class, and it really did help reduce the tightness in my feet and in my heels. And when you're doing this, it should feel good. We don't want any pain. We want to make sure it feels good. And then let's relax. So that stretch that I had you do before, I want you to do that again. Place your hands on your thighs. And then relax. So I always go immediately down, and I'm able to hang out a little bit further when I do this. That is because I am always tight in my calves. And place your hands on your thighs, roll it up. So if you're really flexible in your calves or whatever, you didn't see a big change, just watch me. I went down a little bit further on that exercise. So that just shows you how you can have like immediate effects. Now, is this all day? No, I mean, it's going to be, it's temporary, but if you do this on a regular basis, it will help reduce your tightness. So what I want you to get now is a tennis ball and a wall. Okay. So our next exercise, I have to say, it's one of my favorites. A lot of participants like this exercise because it just feels good on their back. And so what I'm going to do is I'm going to be against the wall, and I'm going to have the tennis ball on my back. Okay. So if your feet are closer to the wall, it's going to put less pressure. You're going to put less pressure on the tennis ball. If you move your feet away from the wall and lean into the wall, it's going to put more pressure on that tennis ball. Okay. So, you may, if you haven't done this before, I would stay close to the wall. And what I'm going to do is I'm going to put this on my back, a little bit below my shoulder blade, but I'm not putting the ball on any joints or any bones. So I'm not putting this on my spine. I'm putting it on one side of my spine or the other. Okay, so I'm not going over any bones or joints with this. And so right here. And then what I'm going to do is I'm going to do a short bend knee, not too much, and it's just a small movement. Now, if you want to go a deeper bend knee and have a bigger movement, please do that. But do what is comfortable for you. And remember, your shoulders are back, but they're nice and relaxed. Try to be relaxed as you do these exercises. And so you're just rolling down and up. And then I'm going to go and move the tennis ball to the other side of my spine, down. It's kind of like one of those massaging chairs that you may have seen, but you're doing it yourself, right? And relax. Now I'm going to go to the other side of my spine, but I'm going to go about middle of my back. So it's going to roll up, okay? And nice and slow. Now this is the part of my back where I'm going to have a tender spot. So if I get to a tender spot, I may hold, oh, I found one. So I may hold like this. I may move it side to side. It just depends. It's kind of tender today, so I'm kind of going rolling over it. And what's great about the tennis ball is you can move it. Move it around a little bit on that back. And then you can go to the other side. down and up. You can always move it side to side if you like. It should feel good. And I'm hoping that you guys are feeling this too. And then I'm going to move the ball to my lower back. Okay. Lean against it. Down and up. You can always roll it side to side. And then let's try the other side. I hope I'm not moving too quickly through this for you guys. And sometimes, like right there, my ball slid. It kind of helps if you have a wall that's textured, because then it kind of grabs that ball a little bit. Like I've tried it like on mirrors or, too smooth wall, my ball is just always moving. So if the wall has a little bit of a texture, that does help to hold that tennis ball. And relax. So you guys can continue to do that for the next minute or so, but while you're continue with that, I'm going to show you another thing you can do if you have two tennis balls. So now I'm putting them on either side of my spine, okay? Doing the same exercise, but on both sides of my spine. And then I'm going to go show you how it looks if you go into a deeper knee bend. And now I'm rolling the upper half of my back. And I'm going a little bit deeper. And if you have to, just bring your hands back to adjust those balls if you need to. Then I'm going to move it to my lower back. It really feels, to me, it really feels good to do this exercise, especially with two tennis balls. Excellent. And relax. Looks like we're going to have time for one more exercise. So I'm going to turn my camera to this side wall. So on this exercise, what I want you to do is your left leg and your left arm, you reach it up onto the wall. So you're trying to get as close to the wall as you can. This is a good stretch. This is just a good stretch we do at our Flow Friday class. We just stand here, okay? So then to massage this, you can use a ball. And I'm going to put it right here. Don't massage your armpit, but on the outside of the armpit, you can. Okay, so that's your lats, what we call it. And then bend your knees a little bit, move it up and down. And then what I do is I just move it up. Oops. Move it up to my triceps. And then move it on up. Relax. And then let's try the other. Oh, what first? Let's do our stretch. And then put that tennis ball in there. And then just roll it. Good stretch for your lats, for your tricep. And relax. All right, so we covered 3 stretches today, or 3 massages. First we did your feet. Then we did the entire back. And then we did this area as well.